नमस्ते दोस्तों, सरल बात में आपका स्वागत है। दोस्तों, today our topic of discussion is stroke.
According to World Health Organization, almost 50 million people suffer from stroke, in which 5 million die every year because of stroke and another 5% suffer from permanent disability.
Stroke has really become a matter of concern because in India also many young people are suffering from stroke. Let's meet Dr.THomas Koshy and know more about the reasons of stroke, the preventive measures of stroke, the symptoms of stroke, and how to treat stroke.
Dr. Thomas Koshy is a well-known cardiologist and diabetologist. He has his own hospital, Holy Trinity Hospital, with well-equipped equipments and machineries in Mulund West. He is also a consultant physician in FORTIS Hospital as well as MT Agrawal Municipal Hospital, Mulund West.
Let's welcome our guest, Dr.THomas Koshy. Okay. Welcome, sir. Welcome to our show, Saral Baat. Thank you so much, sir, to share your precious time with us. Sir, today our topic of discussion is stroke, and I just want to know that what are the warning signs a person gets when he is going to get stroke?
First of all, let me thank you, ma'am, for once again inviting me to your this wonderful program. Stroke, it has multiple features, many features. But what I want to say is that there are few symptoms which we would want our people to know. What I am doing is I am just giving you a small acronym. It is called BFAST. BEFAST. BFAST. So first B stands for balance. Suddenly, a patient may feel that, that he is losing balance. For no reason, the balance is lost. And E is eyesight. Suddenly what happens is, they feel that they are not able to see properly. Suddenly there is a loss of vision. And FAST, fast, means facial asymmetry. When the patient is smiling, suddenly you feel that the face is deviated to one particular side. The facial symmetry is lost. So that is at F. And A is arm weakness. Suddenly they feel that the arm power is lost. They are not able to lift the hand, or whether when they are writing, the pen is dropped, or if they are holding a spoon or a cup, the cup is dropped down. So the arm weakness is there, or on the leg the weakness is there. And other thing is speech abnormality. They are not able to talk properly, or suddenly the person in front feels that when you are talking, the person is not able to understand the speech. That means there is difficulty in understanding the speech. And the last, that is T, that is time to rush to the hospital. So for a person to remember be fast, BEFAST, fast. So these are very subtle and early symptoms. These are warning symptoms that usually come.
Whatever you said that signs of stroke, I think so is the similar sign for paralysis also.
Yeah. So actually, let me just tell you what stroke is first. Actually means there is death of the brain cells. When the brain cells are dying because they are not receiving oxygen. Now people ask, that why they don't receive oxygen. There are various causes for them not to receive oxygen, because the blood vessels which are going to the brain, they can be either blocked, either with a clot. Okay? So clot like an embolism, which can come either from the heart or from any other parts of the blood vessel. But clot coming can cause decreased blood supply to the brain, so less oxygen reaches the brain. Or what happens is, the blood vessel is blocked because of atherosclerosis, what is called as deposition of fat within the arteries, or there is a rupture of the artery. The arteries which are going to the brain are ruptured. So any of this can cause a stroke. Depending on which part of the brain is affected, accordingly we get what is called as paralysis. So suppose the brain part that is affected is connected to the face or to the hand. So then you get a paralysis of the face or a paralysis of the hand. Sometimes what happens, that area is paralyzed where one half of a whole body is paralyzed. So it again depends on where the clot is formed or where the artery gets damaged, and accordingly the paralysis takes place. So paralysis is one of a feature of strokes that is seen.
So what are the causes?
There are many causes for stroke, many causes. Now, most common cause that we see is hypertension, diabetes, normal cholesterol levels. These are the common causes. And very habits that can cause sedentary lifestyle. lack of physical exercise, abnormally eating pattern, obesity is another thing, smoking and alcohol. Smoking alcohol can cause lack of sleep, increased stress. So we get stroke in young people also. It is very, very common. That is seen. Usually above 60, the causes are very, very common. And this is a very, very, very common cause for morbidity and mortality across the globe. In the US, it is estimated more than 8 lakh people get strokes every year. Even in India, the rough estimate is around 150 to 200 people per lakh of people develop stroke.
So, sir, as you said, paralysis is one of the feature of stroke. So, I would like to ask you one question related to paralysis. That if once paralysis happens to a person, so and if he is cured, is there possibility that he can get paralysis attack again in his lifetime?
Chances of developing a second stroke are much higher if the patient does not modify all these factors which I told you, like correcting his hypertension, correcting the blood sugars, the blood cholesterol, and all these factors, if it is not corrected, chances of developing a re-stroke are much, much higher. So patient needs to be very cautious about maintaining the lifestyle, maintaining a good diet, and seeing that the medications are taken properly, by following up with the doctors regularly, so that the stroke can be prevented second time. So proper exercise, proper walking, all these factors are very much essential so that the second stroke is prevented.
So, what are the types of stroke?
There are many varieties of strokes, but very commonly, we see two types of stroke. One is a clot coming into the blood vessels of the brain, and where the blood circulation is stopped to that particular part of the brain. Now that is a dangerous type of stroke, but usually the mortality and morbidity are less compared to the second type of stroke. Second type of stroke is what happens when a blood vessel gets ruptured. An artery can get broken, it can get ruptured. So what happens? There is bleeding within the brain. This is a very dangerous type of stroke, because what happens? There is a bleeding, and depends on how fast the bleeding takes place in the brain, or how much of bleeding, or how much of extent of the brain is damaged. This is very dangerous, because this is what we known as intracerebral hemorrhage, or what is called as a subarachnoid hemorrhage. This is very dangerous, because if it is not treated appropriately and at the right time, the patient can go into coma, and even can lead to death also. So this is a very dangerous type of thing, usually seen in the background of hypertension. Severe hypertension is the most common cause for causing this rupture of the arteries in the brain.
Sir, I want to know, is this stroke hereditary?
Yes, ma'am. There are many causes for hereditary strokes also. There are some strokes which are caused because of what is called as abnormal artery malformations that are there, like what is called as perianeurysms, or small abnormalities which are seen in the blood vasculature. Now, sometimes what happens, these small abnormalities can break for no reason. So this is a hereditary factor that is seen. And usually what happens is, those people whose parents are diabetics or hypertension, they usually have a tendency to develop hypertension and diabetes at a much younger age. So their chances of developing a stroke or a paralysis is much higher compared to the general population. So when they know that their parents or in the family there is a history of stroke or paralysis, they have to be more cautious and take more lifestyle measures, so that they can prevent the onset of paralysis that takes place. Stroke and paralysis, basically, what I want to advise to all the youngsters who are watching is lifestyle changes are very, very important. What they have to do is, because sedentary life has become a very common part of people. Most of the time, we have a desk job, and it is very stressful job that is there. So reducing stress is very important, by the practice of meditation and a regular physical exercise. Taking care of diet is very important. Consuming less of fat and oily and fast foods, and going more for raw vegetables and plenty of fruits, and eating less of food which has got high sugar content, high fat content, and less of dairy and animal products. So so all these changes are very important. Rather, I would say that stop smoking, absolutely stop smoking. And if alcohol intake is there, to minimize the consumption of alcohol or to avoid alcohol, because all these factors predispose a person to develop strokes. So these are very, very important. Maintaining a good lifestyle is the most important, so that the patient can prevent these strokes and other formation that is there.
Thank you so much, sir, to share such important information with us. Friends, if you want to know more about this particular topic, about stroke or paralysis, you can mention it in our comments. We will definitely come back to you. And if you are interested in having more information on different medical topics, you can subscribe the channel and be connected. Thank you so much. We'll be back again with a new topic. Thank you. Thank you, sir.